Does an apple a day really keep the doctor away? Research and Evaluation by Melanie, Katie, Donisha, Stephanie, and Tamara. Research is an organized process using the scientific method for investigating problems. The purpose is to conduct a thorough investigation in order to gain knowledge and understanding for a specific topic. Evaluation assesses a process or program to provide evidence and feedback. The purpose is to investigate if the initial objectives were met and if the information presented is being understood. Today's objectives are to gain a further knowledge of how to research and evaluate, to identify all 5 competencies in Area 4 of responsibility, and to explore how research and evaluation relates to public health in various public settings. In the following slides, we will explore various settings where research and evaluation are used. In the community setting, evaluations provide necessary information to support programs in the community. In the school setting, health educators may be called upon to assist in documentation of students' knowledge on health, attitudes, and behaviors. In the school setting, evaluation and research is very important in curriculum goals, objectives, and learning activities. In the healthcare setting, health educators must be able to understand and interpret research findings for their patients and their families. Evaluation and research becomes increasingly important in addressing chronic disease conditions and reduction for health risk behaviors for primary prevention. In business and industry settings, health education specialists may be able to help determine quality and cost effectiveness of competing health plans to benefit employers and employees. At the college and university setting, health educators are expected to engage in scholarly endeavors that include research, grant writing, and dissemination of research findings. University health service settings. Health educators face some of the same issues as those in business and industry and healthcare settings. Skills in all facets of research include qualitative and quantitative research. 4.1. Develop evaluation research plan. Determine reasons for conducting the research. Create objectives for the potential plan. Create effective research and evaluation questions to guide research. Feasibility and validity in conducting research. An example of this would be if Sally heard from her cousin Adam that an apple a day keeps a doctor away. She wants to investigate if eating apples daily could improve her health. 4.2. Design instruments to collect evaluation and research data. Instruments are used for both qualitative and quantitative data collection method. First, research consider the type of data collection that is going to occur. This process can be time-consuming. 4.2 continued. When preparing new data collection, it's important to keep in mind that the instruments are easy to use. It's easy to understand the language. Avoid technical terms and be sensitive to the feeling of the respondents. Thank the respondents and keep it short. An example of this would be if Sally decides that she's going to create and send out a survey via email with a series of questions regarding current health status and eating habits to all of her coworkers in her office to get a better general assessment to begin her research. 4.3. Collect and analyze evaluation research data. Analysts of findings detect patterns and evidence by isolating important findings. Deciphering facts from a body of evidence involves deciding how to organize, classify, interrelate, compare, and display information. An example of this would be if once Sally creates her survey online, she sends it out to her coworkers. She then gathers her results and looks for any noticeable patterns. 4.4. Interpret results of the evaluation and research. Interpretation is the effort of figuring out what the findings mean and is part of the overall effect to understand the evidence gathered. Health educators' ability to interpret results from their own and other evaluation and research is essential. Evidence must be interpreted to determine the practical significance of what has been learned. An example of this would be if in Sally's research she finds that those who typically eat an apple daily report less sick days than those who choose not to. 4.5. Apply findings from evaluation and research. Findings can be applied based on the intention of the user. Results from research and evaluation can be in a form of a presentation or an overview of the report. An example of this would be if Sally compiles her findings into a report and presents them to her coworkers at their next staff meeting. She suggests that the company makes healthy fruits more accessible in their workplace to help reduce the amount of sick days workers actually use.